Hey Jen,
Hey
nice to see
Stuart.
you.
Yeah, good to see you too. How you doing?
I am doing well. So I think today we are discussing acute COVID, and really everyone and their mother around me is getting COVID right now. Right now it's mid-September, and things are flaring. My neighbors got it. I got lots of kind of friends who've got it. And so I think that we're going to talk about what would I do or what would I recommend to my patients if they were to get acute COVID. I think the underlining thing is preparation beforehand, and to make sure that when COVID strikes, that you are in a position that you can properly help yourself.
Yep.
So yeah, so Jen, what would you do if you were to get COVID?
Yeah, so I'm gonna second that on the preparation. I've definitely ordered quite a few things ahead of time, just like because I agree. A lot of my friends, family members, stuff have gotten COVID recently, and it's just, no matter how hard you try, sometimes you can still get it. It's the most transmissible pathogen so far on Earth, and so you can still get it. So I've definitely stocked up on quite a few things ahead of time. So things like certain like nasal sprays and oral rinses, antihistamines, various things that I wouldn't want to have to order and then wait for while I'm acutely sick.
Mhm.
Yeah, I mean, my kind of I tried to kind of go through a lot of the literature. So I've been sort of following this for a while, put together a protocol where got like all the research there. My biggest thing, I would definitely try to get Paxlovid for sure. There
Mhm.
are some data out there showing that it may reduce the risk of long COVID. For me, I have some risk factors that put me at like higher risk of severe COVID, but um, that's actually not my biggest fear. I've been vaccinated several times. For me, it's more I don't want to get long COVID from this thing.
Mhm.
Um, that's
Yeah.
my biggest worry. Now, some people, it may be more so that, like, hey, I've got major risk factors for severe COVID, and that is more the risk I want to mitigate. But I think in both cases, there's things that actually seem to work across the aisle and help both. So Paxlovid is one of them.
Mhm.
Trying to get that, even like it was approved that pharmacists can actually write Paxlovid for you if you have acute COVID. I know some pharmacies it doesn't sound like are participating in that, but urgent care, your primary care doctor, you could even possibly have someone write a prescription for you and just have it on hold in your chart. So, meaning like you don't fill it, but that way, if you get acute COVID, you can just call in and they can just send it in quickly for you so
Mhm.
that there isn't much of a delay. Because usually you really need to start Paxlovid within 5 days of your first symptoms or your positive test. Um, the other one that is more so for long COVID prevention, but also there may be some mortality benefit too, is metformin.
Mhm.
Metformin, typically diabetes drug, it's dirt cheap, been around forever. And some people actually use it for longevity and anti-aging. And that one, there was a study done that was actually like it was randomized, and they were looking at several different drugs and if they impact risk of long COVID. Metformin actually seemed to drop the risk of getting long COVID by about 42%, which is pretty dramatic. So
Mhm.
to me, I've tried metformin before and it definitely gave me like diarrhea and upset stomach, which is a side effect of it. But knowing that it would lower risk of long COVID by 40%, that might be something I'd actually put up with.
Yeah.
Um, yeah.
Yeah, no, I agree. And so I'm going to jump in here and kind of comment on the Paxlovid and the metformin. So I guess I'll tackle Paxlovid first, which is um, it's a tool to help, and really being prepared is, I think, the most important thing. There are other options that are available. So something that I did want to bring up would be something like Tolovid. So Tolovid is a supplement that you can buy online that has 3CL protease inhibition. So it is something that's available if you can't get Paxlovid. I kind of like reminding patients like being prepared is important, because if you contact your doctor, your NP or your PA, and you ask for the drug, it might take a day or two. There might be kind of hiccups behind all of this. So it really kind of being prepared. And if you're kind of more on the natural side of things, there are other options available for people that do have some anecdotal evidence. I can't really speak to the efficacy of Tolovid. I haven't done the studies, but I know that I've definitely heard that it works in some people. So that's definitely something I wanted to bring up. Number two is metformin. Metformin is probably my favorite drug. It is a great medicine. I will tell my patients that it's probably the most prescribed drug that I've used. It is very cheap. It comes from the French lilac. And in addition to reducing long COVID, in a paper in the New England Journal of Medicine, which is considered to be one of the most prestigious journals, it did show a benefit in secondary outcomes of reducing hospitalizations and severe and ER visits. So, really good drug. I do tell people watch out for the stomach issues, but I actually take this medicine for other reasons. I used to give this drug to prevent diabetes and pre-diabetics. It leads to 5 to 10 pounds of weight loss in some folks over a long period of time. And again, as Jen mentioned, it people use it sometimes in longevity. So really what I tell people is if you've got people using it to try to extend their life, like probably not too risky, has good data out there, and is a good drug.
There's a couple places where you can get it online through anti-aging companies. Like I think Ageless RX can prescribe it remotely. I believe also like it's called healthspan.io also has it, if I remember right. So if you're, if you can't really get it or something, but remember, even if you go through something like that, it's going to take a couple of days to get through the process and get it shipped to you and stuff. So generally speaking, you'd want to have like a plan for that ahead of time.
Yeah. No, I agree. And I did check Ageless RX actually this morning for metformin at $25 a month. Definitely you can get it cheaper if you plan ahead. So again, another reason why to do this a bit quicker. What I jump to in acute COVID and in long COVID right away is microclotting and wanting to prevent kind of these small thrombosis from occurring. And so I would reach for aspirin. So, Jen, you and I have talked a lot about aspirin, have learned a lot about aspirin. Maybe we can talk a little bit about what type of aspirin and kind of what we think is appropriate.
Yeah, so I personally would do baby aspirin. Now, if you know that, like, let's say your platelet counts tend to run high, then you might need baby aspirin twice a day, really, because you produce about 10% of your total platelets in a day. But if you're making extra platelets, i.e., your counts are higher at baseline, you're probably making more like 20-30% of your total platelets a day. And so you really need to, aspirin doesn't last that long in your system. So it only inhibits the platelets that are there in your blood while the drug's around. And then once the drug's gone, all the new platelets you make through the rest of the day are not inhibited. So someone with higher platelet counts, you'd need to take it twice a day. Someone with normal platelet counts, if they haven't really ever flagged high on a complete blood count, CBC, then you're fine just once a day. I believe there was also mortality benefit data. It wasn't like super strong, but I believe that people on aspirin generally had an improved mortality from acute COVID as well. We do know that most viruses will activate platelets to some degree. That's just kind of a natural feature of like platelets have different receptors on them that can bind to various different particles from infectious things. And so it can activate them. And when they're activated, it's easier to clot your blood. And that's definitely been something that's shown in COVID in particular, is that people get hyperviscous, meaning their blood gets really thick. That's been shown in studies, much higher rate of blood clots acutely. And there's also this like delayed risk of blood clots. Like your blood clot risk is elevated for as much as like a year. And then if you get reinfected, the risk increase stacks each time you get another infection. So this is Ziad Al-Ali's group has put out amazing research on this. Huge numbers of people studied. The charts were, I think it's like something close to north of like 10 million charts reviewed for this. So I would personally take baby aspirin, and usually they always tell you if you're having like any kind of heart attack type symptoms, you always chew the aspirin because it kicks in quicker, you absorb it faster. Personally, I would use chewable or sublingual. Um, there's some thought that, particularly in women, that women might not absorb aspirin the same way as guys do, that it might be absorbed more so in the stomach. So if you take like an enteric coated one, it may not either fully absorb or it might absorb much later, like further down your GI tract. So for guys, you're probably fine just taking regular old aspirin or enteric coated is probably okay. For women, I'd probably aim more towards just regular aspirin, not enteric coated, or like a chewable, just to make sure you're really getting it in there every day and it's not sort of slow trickling in and not doing the full job.
Yeah, yeah.
Um,
I have, obviously, part of treatment for long COVID, one of the proposed treatments is triple therapy, so using aspirin and amongst other things to treat this. And so I have experience, treating with aspirin. Aspirin can be a tricky medicine, and so some people will have a bit of stomach upset. So going to a chewable can be a bit tough for people. And so try to take it with food. If you cannot tolerate it, I would say probably go to the enteric coated if you're unable to. Like I think at least it's something rather than nothing in terms of aspirin.
and from the studies I looked at, it looks like enteric coated between men and women, it did get absorbed eventually. Like the total amount that made it into your system towards the end, like was the same. At
Hmm.
least in one of the studies they found. So if you can't tolerate it, if you got stomach ulcer history and stuff like that, or you have a bleeding predisposition, then aspirin might not be a good idea for you. Like if you bleed already, if you're on blood thinners, that's something where you
Mhm.
not have to, or if you have an aspirin allergy, definitely this is when you want to run by a practitioner before you start it. The other thing is sometimes patients with like mast cell activation, they can react kind of strongly or almost inversely to aspirin. So usually, it can benefit people with MCAS, but it can also make them worse. So generally speaking, it's kind of good to know if you tolerate aspirin before you get COVID. So it's something to like ask your provider about ahead of time, long before you get COVID. And maybe if they're like, yeah, this seems like a safe thing for you to try, but you're not sure if you'll tolerate it due to like MCAS or potential allergy, then try like a very small amount and have Benadryl nearby and stuff, and see if you tolerate it. And if you do, then you're like, okay, cool. At least I know that I can take aspirin if I get COVID. But if you don't tolerate it, definitely let your provider know so that they can add that to your allergies and intolerances list. And then you'll know, okay, aspirin's not the thing for me if I get COVID. The
I
other
think
thing is age. So aspirin during an acute flu-like illness can cause something called Rey syndrome in children and teenagers. So you never want to give aspirin to kids and teens if they have an acute flu-like illness. So aspirin for COVID would only be for adults, not for teens and kids.
I looked up the dates recently, actually, and so the United States recommends anyone less than 19 fall into that kids and teens category, whereas the United Kingdom recommendations are less than 16. Again, I'm not a kid doctor, not a pediatrician, but just wanted to make sure that people are hearing that.
And you can always ask pediatrician to weigh in on that. And this is the whole thing about being prepared ahead of time is asking these sorts of questions so that you know, so that it's not
Yeah.
like you're having to figure all this out while you're acutely sick and you're like, oh my gosh, I just want to sleep. It's knowing this ahead of time, having that plan. It's like if you live in a really earthquake prone area or like a tornado prone area, you've got your like plan, your emergency preparedness plan. You may have your emergency preparedness kit that's got some food, some batteries, like maybe a little radio, some stuff you can use to get through an emergency. I would have a COVID emergency prep kit.
So nattokinase is a kind of a natural enzyme that comes from the food natto, which is Japanese food that people often eat for breakfast. It supposedly tastes terrible. But there is some good data in vitro that nattokinase helps to break spike protein. Dosing, these typically it comes in 100 milligrams or 2,000 functional units or FUs. And this is for nattokinase. There's differences for lumbrokinase and serrapeptidase. But typically I do 100 to 200 twice a day. Sometimes we go up to 300, which is 6,000 functional units twice a day.
The one that was tested to see if it breaks down spike protein was nattokinase, and it was done in a
Yes.
petri dish in vitro. So, we don't know how well it does this in vivo, meaning in a person, but at least that's pretty interesting. And the other benefit of it is that it does also break down fibrin. That was kind of the original use for a lot of these enzymes, was like breaking down fibrin or breaking down different kinds of biofilms. So it was just kind of like an extra bonus that, like, oh, nattokinase also might dissolve spike protein. That's pretty cool. Since spike protein, binds to ACE2 receptors, it can cause them to downregulate, damage them. It also seems to possibly be thrombogenic, meaning it actually can bind to fibrin in an area where, so fibrin is kind of like, it's one of the most like, fibrinogen is the precursor to fibrin. It's one of the most abundant proteins in your blood. And what happens is when thrombin comes by, it like activates it. And so then it forms this insoluble like fiber. So imagine it looks kind of like a little spaghetti noodle. And what that does is those spaghetti noodles, they kind of cross-link and they form like a mesh. And that's what stops you from bleeding. So like it forms this sort of sticky mesh that then platelets and red blood cells can get stuck in, and you form clots so that you don't bleed. But there's another enzyme that comes by. Your body's coagulation is always in an active equilibrium. So you can make clots, and then your body also breaks them down. So you don't just pile up a bunch of clots and then all your blood vessels clog up. Your body's constantly making and breaking down. There's a balance, the yin and the yang. So the problem is that spike seems to bind right to the section of fibrin, that spaghetti noodle, that the enzyme that's supposed to break it down binds to. So when spike, this was a study out of UCSF. I believe it's still a preprint though. When spike is bound to that fibrin, not only does it form a weird looking crosslink, like it looks different under electron microscopy, and they showed really cool pictures of this, but also it takes longer to break that fibrin clump down. And that has been seen by groups like Dr. Risu Pretorius and Doug Kell and Caroline Dalton, and Dr. Lobster, all these folks who've been looking at microclots. That's what they've been saying is like, hey, other diseases of microclots, people make them when they're acutely sick, but then they're supposed to kind of go away. But in long COVID folks, it seems like they're bigger, there's more of them, and they're taking way longer to go away. And it kind of, just piecing together the science, it looks like it kind of makes sense if spike kind of blocks your own natural enzyme plasmin from being able to break down that fibrin, that natural balance of making clots and breaking them down. Suddenly you can't break them down anymore, and so you just keep making them and making them and making them. And that doesn't do great things to your blood vessels and your body. So, so nattokinase can help break down fibrin, presumably from a different area than the one that the spike is bound to, but I'm not 100% sure. I do know that there's some researchers who are actually testing nattokinase extracts on microclots to see if it can break them down. So they're actually going through the same thing of figuring out which brand should we use, which one's best, how do you prep it, blah, 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 blah. So to really kind of show that in a petri dish, because that's, lumbrokinase is another enzyme that breaks down fibrin. So is serrapeptase. So all of those guys are kind of on our list, but natto is the only one that we just happen to know, also might break down spike. Might as well use that one. Now, some people use a combo of all three, and you can totally do that. But if you're kind of, cost limitations and stuff, nattokinase would probably be the one to go for, since it sort of have dual purpose.
Other things like, bromelain is one potentially. There are actually many different ones. But NAC, maybe since I kind of jumped the gun on that, NAC and acetylcysteine is something that potentially can help with this. So it is something that we do recommend in a lot of our patients to help the mitochondria. There's extensive evidence that during acute infection with COVID that the mitochondria are damaged. We're seeing more and more evidence and in long COVID that the mitochondria are damaged. So we do supplement with NAC to help with that. It is also just kind of like a free radical scavenger, helps kind of with that process. I'll kind of talk about my augmented NAC, but I guess, Jen, any kind of opinions more on this? I know it does other functions as well.
Yeah, so N-acetylcysteine, it also can help with fibrin to some degree. It's kind of a milder effect, and it can help loosen up mucus. So if your lungs are kind of full of mucus, it can kind of help you cough it up a little bit easier. In some cases, it's actually dosed before you give contrast to people in the hospital to kind of help protect their kidneys. So it's kidney protectant. And it's a precursor to glutathione. So glutathione's like your master antioxidant for your body. It helps soak up free radicals. Glutathione's also really important for immune cell function. So like natural killer cells, which they kind of go around and they clean up certain cells that when the viruses that infect them are really smart and they cause them to downregulate the proteins that express virus on the surface and flag your immune system saying, hey, I'm infected, come by and help me. Certain viruses have figured out a way to get your cells to not make that protein. So the cell can't signal to the outside that it's infected. And so, but the natural killer cells, their job is they actually look and see, hey, you don't have enough of that signaling protein on your surface. You're probably infected with a sneaky virus. I'm going to come and cause you to basically undergo cell death. So these cells are super important for things like getting rid of certain viruses like COVID that does suppress MHC production, that protein flag. Also things like cancer surveillance. And there's been some interesting literature out there and just even I think there was an entire conference on it about does COVID actually increase risk of cancer down the line? And there's some interesting science behind that, kind of more for a different talk, but
Yeah.
making sure your natural killer cells work and stuff is good. So glutathione, there's other things that can help that, but those are definitely a cell type that you want working,
Yeah.
and one
And
that is
also, yeah.
shown to be impaired in ME/CFS and long COVID.
Mhm. Is that natural killer cell. And
Mm.
I also just think about kind of like I frequently talk about, risk versus benefit, but also cost and benefit, and, pretty cheap thing. I'll briefly mention, augmented NAC actually trying to figure out, it's reportedly has more spike degradation, but really can't tell if that's true. But I did want to mention that because I have had several patients reach out to me regarding it, and I always want to learn and figure this out. I think maybe we can pivot to maybe the antihistamines. I know that famotidine was associated with reduced mortality in acute COVID-19. Super easy medicine to get. You could get into a local drugstore and pick that up. And it is a treatment for mast cell activation. And then, of course, we've got all our other kind of antihistamines that we can try. I think it can become confusing for patients because there's so many different types out there. But yeah, I think maybe we can do a little bit of a dive into that.
Yeah. So H2 blocker is the one that was said it was famotidine, so Pepsid. And basically, they noticed that people who were on Pepsid had reduced mortality from acute COVID. And so this is, they don't know exactly the mechanism for that. It's possible maybe it's been elucidated since, but Pepsid actually has quite a few different things that it does. So it lowers stomach acid, but it also it blocks histamine type 2 receptors. That's actually how it lowers stomach acid. It is an H2 blocking antihistamine. And there may be other things that it's doing. There may be some immune modulatory effects and stuff too. So this one is good for mortality reduction. And also, we've seen a fair amount of mast cell symptoms showing up in patients with long COVID. And so anything that's going to help keep your mast cells a little bit more stabilized and calmed down, kind of help block some of the effect of that, I think would have benefits. And that may actually be part of the reason that famotidine was helping, perhaps.
Yeah, no, exactly.
There are other H2 blockers. But I think it was like Zantac was taken off the market due to a manufacturing issue that they thought had some chemical that caused cancer. But I believe there's now a Zantac on the market that just contains famotidine. It's basically Pepsid. So, and then there's Tagamet, which is cimetidine. But Tagamet has a lot more drug interactions than Pepsid does. And so generally Pepsid's the safer one. And Pepsid was the one that was kind of, the famotidine specifically was the one that was kind of in the studies because they use it frequently in the hospital. And then H1 blockers. So another type of antihistamine, but the standard ones, more ones you're familiar with as an antihistamine. So like your Allegra, Claritin, Zyrtec, Xyzal, those are all the trade names for them. But basically, these are the ones that you take if you've got allergies and you're sniffling and the pollen's high outside.
I know you use this religiously. You have done a very good job at not getting COVID. So I will use it. Kind of when I go out and spray my nose. But there are several things, and again, a little bit more of a deep dive. You can find that YouTube, but maybe just like a few one-liners on that would be really helpful.
Yeah, so usually, COVID typically infects you through your nose and through your mouth, and most of the viral load initially is there. And so anything you can do to reduce viral load is going to help reduce like mortality risk, severity of your acute infection, but also one of the risk factors for long COVID development was how high your viral load was kind of like during the acute infection. So anything you can do to reduce viral load is going to be helpful. And so basically, it can be any kind of nasal rinse, even just saline, high volume neti pot saline. If you do that twice a day and do a real good rinse, that actually improved mortality rates in acute COVID. So, but there are some things that have some kind of antiviral components to the spray that have also been studied, and they've been shown to have even more of a like risk reduction. And we went through all of these in detail in our previous talk that's more about like COVID prevention. But the one that I use because it's cheap and relatively available is colloidal silver. There was a placebo-controlled study that was done at a hospital in Mexico, and they were actually looking at risk reduction of people who were all exposed to COVID patients. They were taking care of them in hospitals, and they found a very large reduction in COVID infection in the people who were using colloidal silver versus the people who were using just saline as the control. Just like you'd have an emergency earthquake kit or tornado kit or whatnot, depending on where you live, have an emergency COVID kit. Get this stuff ahead of time. Have a plan. Ask the questions of your doctor, your pediatrician, whatnot, ahead of time so that you're not scrambling to figure this out when you're acutely sick and feel really bad. And so really the thing is, if you're mostly young and healthy, yes, you can still die from COVID, but your bigger risk at that point is long COVID. And don't take that risk lightly. We treat long COVID patients, and it is amazing. It's taken marathon runners, hardcore athletes, people who were not winded running like 10 miles are now winded walking up one flight of stairs. And this was within like 3 to 4 weeks of having this virus. So it's not like they were just deconditioned. You don't drop from a 10-mile runner to I can't walk up a flight of stairs in 1 to 2 months. It takes a lot longer than that to decondition, and they've done studies that show that it's not deconditioning. So really, it's roughly on average 10% of people, so 1 in 10, will get long COVID after a COVID infection. And it's not like, and we don't know like repeated infections. Does your risk go up if you've had COVID now your 5th time? We don't know. Vaccination does seem to reduce your risk of long COVID, but it reduces it a fairly minimal amount, something like maybe about 15%. It seems like it does stack though. So the more vaccines you have, it keeps kind of adding on to the risk reduction, but it's a fairly like minor risk reduction. So compared to like metformin taken during acute COVID. So just don't underestimate long COVID. If you can help reduce it, even just adding metformin, if you can't even get Paxlovid or Tolavid, even just metformin, just reducing that risk of long COVID, because let me tell you, you do not want that disease. You just don't.
Yep. I gotcha. Well, thanks so much for chatting, and I enjoyed it. And hopefully we can help a few folks avoid getting long COVID and doing okay with their acute COVID. And have a good rest of the day.
All right. Thanks, everybody.
Adios. Bye.
Bye.